All right. Tanya, are you ready?
I am ready. Hello and good morning. I am Tanya Salee, an AARP volunteer with the Louisville Community Team. I welcome you to this important discussion about COVID-19 vaccines. AARP is a nonprofit, nonpartisan organization. We've been working to promote the health and well being of older Americans of 60 years in the face to promote health and well-being of older Americans for 60 years in the face of the global well-being. I'm sorry. We've been working to promote health and well-being of older Americans for 60 years in the face of the global COVID coronavirus. I'm just having a hard day. Please, I apologize. But AARP is providing information and resources to help older adults and those caring for them. Today, we will be discussing the latest on vaccine rollouts and what this means to the community. We are having this discussion as COVID-19 vaccines are being distributed and the country continues to fight the spread of COVID-19, which has disproportionately affected people 50 years of age and older. We are at a great risk. We have two distinguished guests with us today to answer your critical questions and to help cut the confusion. We have Ms. Rona Rice. She's the director of North Central District Health Department, and Ms. Miranda Bergen. She is the community health nurse at North Central District Health Department. We have the listeners on the phone and online. So we asked them to submit their questions in advance for today's call. We ask you to please mute your phones or stay muted on Zoom to minimize background noise and distractions, which I had earlier. If you're joining us online and would like to ask additional questions about COVID-19 vaccines at any time, feel free during this conversation to please type your questions into the chat box. Ms. Rice and Ms. Bergen will take as many questions as our time together allows. First, let's hear from you about your interest in getting vaccinated for COVID-19. If you are joining us online, you will see the question come up on the screen. The question is, how eager are you to get this vaccinated? How eager are you to get vaccinated for COVID-19? Your answer options are, I already received one or both of the vaccine doses. I'll get it as soon as possible. I'm planning to wait to allow others to get it first. I am undecided. I want to learn more about the vaccine. I do not plan to get vaccinated. Just click one of the bubbles next to your answer and then look for the submit button to appear and click on submit. We'll give you a little time to answer the question before we go over the results. I see that the results have came in, and I see that we have 7% undecided, and I want to learn more about it. And we have 93% say, I've already received one of the vaccine doses, or both, which that's great. This is session today is to help us learn what we don't know about the vaccination. And at this time, I'd like to turn it over to our guest.
Good morning. Thank you so much for inviting us today. It's great news to hear that 90+% of the people watching today have received their vaccine. And we encourage those who haven't to get theirs. And hopefully after Miranda does her presentation today and we take questions, you'll feel more confident about doing so.
Thank you, Ms. Rice and Tanya. My name is Miranda Bergen. I'm a community health nurse for North Central District Health Department. I'm going to go ahead and share my screen. I have a presentation for you today. Can everyone see my screen? Thumbs up, shaking head. Thank you. All right, so North Central District Health Department covers 4 counties. We cover Henry, Shelby, Spencer, and Trimble counties in Kentucky. We do weekly vaccination clinics. And I'll talk to you more about how to get an appointment at that clinic and a little data on our vaccine distribution so far. And so the Kentucky Department for Public Health has phases of vaccine rollout. We've abided by those rollouts, and we're currently in phase 3, where we are actually doing 18 and over. We receive both Moderna and Johnson & Johnson vaccines here at North Central District Health Department. So we are actually 18 and over. Pfizer is for 16 and over. So if you are between 16 and 17 years old, then you do need to try to get a Pfizer vaccine. But we are doing 18 and over in our 4 counties at this time. These were the health conditions outlined by the CDC that we focused on for vulnerable populations, things like diabetes, heart disease, asthma, several things on this list. Again, we are now doing anyone over the age of 18 with or without health conditions. So several things have been going on here at North Central. Along with our weekly vaccine clinics, we have weekly clinics on Wednesdays. We typically put the appointments on our online scheduler, which we'll talk about here in just a few minutes, on the Friday before, and allow from Friday to Wednesday for you to schedule an appointment. And we have assistance for if you do not have internet access as well. And then along with that, we've got special outreach projects that we're doing with special populations. We have received several concerns about homebound vaccines for those that are homebound and unable to travel. And we have taken a list of those names and then gone to their homes in our 4 counties to give the COVID vaccine. So that is something that we've been working on and we're proud to offer. And then we've specifically targeted African American population and Hispanic population in our 4 counties because we're not seeing as high in numbers getting the vaccine in those categories. So we have definitely reached out to churches and other local community places to offer vaccines for those communities as well. And I've got some data on that I'll share with you guys in a few minutes. And so the best way to get the most updated information is to go on our website at NCDHD.com. We post that live. Any information we have daily, we post on our website and our Facebook page. So if you have Facebook, it's best to go and like and follow our Facebook page at North Central District Health Department. And I just have a picture here on the right showing you the front of our Facebook page. So that look for that logo. And any information that we need to share with you, we post on those 2 sites. And our online scheduler will be on the website that I've listed here. And when you go to our website at ncdhd.com, this is what you see. This is our home page. Circled in red, there's 2 ways you can get to our vaccine scheduler. You can go to COVID vaccine info that you see here circled, or you can click this red bar that says important notice about COVID-19 vaccine. Either one of those buttons will take you directly to our online scheduler, which will look like this. So when you click one of those two buttons, this is what it looks like. We do vaccine clinics on Wednesday, and we typically receive our vaccine shipments the Friday before. As soon as we receive that shipment, we know how many and which vaccine, Moderna or Johnson & Johnson, and we will post those on the online scheduler the Friday before. So from Friday to Wednesday, you're able to book an appointment online while appointments last. And you can see here, for this past week, April 7th, we did Johnson & Johnson vaccine. So you would just click that bar. If it was Moderna, where it says Johnson & Johnson right here, would say Moderna instead. So that's how you would tell which vaccine we're doing at the time. And you click that, this black bar here for our event. And it's going to tell you, you do need to live or work in Shelby, Henry, Spencer, or Trimble counties and be in our vaccination phase, which again, we are vaccinating anyone 18 and over. And then you will, it will ask you a series of questions when you hit this next button. It's going to ask you what county you live in, your name, your address, your phone number, date of birth, email, your gender, and then your race and ethnicity. All of this is private information. We don't share this information. This is just for us to know and be able to contact you. After you type that information in and follow the next buttons, it'll allow you to select a time. So you can see here, I've got a screenshot. It will be on the date, and anything in the gray is already taken up. So you cannot pick the gray buttons, but anything in white and blue, you can click on those time slots. So any of those time slots, and you can scroll down and pick the time. And then the very most important thing filling out this questionnaire is the submit button, and that finalizes your appointment. And again, we do those on Wednesdays. If you do not have internet access, or if you can't, having trouble figuring that out, we can certainly help you on our helpline. We have a COVID-19 helpline here at North Central District Health Department. That is open Monday through Friday from 8 to 4:30 in the morning, 8 a.m. to 4:30 in the evenings. And the phone number is listed right here for you, 390-2600. It's also in the chat box. And there will be an automated message. You'll listen to that message, and then an operator comes on as long as you're calling in those business hours. And we'll help you get scheduled, and we'll ask you those questions for county, name, address, date of birth. We'll ask those questions and fill that in for you and get your appointment scheduled. And I do want to go back to that. We do have Spanish interpreters on that line as well. And let's go over some data just for where we're at right now with vaccine. So total given, this is not including this past Wednesday's event, but so far our district, we had a big milestone. We did over 10,000 vaccines. We are now at 11,158 vaccines for our district. And we've got it broken up here on this graph for you between Moderna Prime, which is the first dose of Moderna, and Moderna Boost, which is our second dose of Moderna, and then our Johnson & Johnson. So you can see the difference there. We haven't had Johnson & Johnson very long, so we've only had a handful of events with the Johnson & Johnson vaccine. So that's why there is a little bit more Moderna. And then the next graph will show you about age distribution of our vaccines. So from our prime, our first doses, and you can see majority is 70 and above. We did spend the most time when we were going through the phases on this one. So we have reached more of the 70 and above population, which we're very happy about. And then you can see it does start to dwindle down the 18-19, which we just opened that phase last week. So we're hoping to increase this number.
We do have one question in chat about this chart specifically. Okay, we just got an answer too. So the question was, does it include vaccines given by other providers like Walmart or Walgreens? And so the answer in chat was, this is just NCDHDs. Thanks.
Yeah, Thank you for clarifying that. This is just North Central District Health Department's data. Okay, and moving right along, I've got a chart here telling you about the population vaccinated by North Central. So this just talks about our 2019 total population in our 4 counties. This is this first box here. And then how many we have vaccinated, broken down between Johnson & Johnson and Moderna vaccine. So in Henry County, we are at 6.73% of population have been vaccinated. And then Shelby County, 6.38%. Spencer 5.48, and Trimble County 4.14. So that's broken down in our 4 counties. And this again is just for North Central District Health Department's data. And then specifically for the African American population in our North Central District Health Department counties. This is the numbers that we have in our district is this bar here on the right. 276 African Americans have been vaccinated from the coronavirus. And then you can see broken down at the bottom here by county. So Henry County, 9.3% and so forth. And then the next graph is our Hispanic or Latino population in North Central District. And you can see here we have vaccinated up to this point 184. And we've got the percentages per county again here at the bottom for you. Shelby County, I do want to note that is our largest population of our 4 counties. So their numbers are typically higher. The vaccine clinic is held at our district office, which is also in Shelbyville. Anyone from our 4 counties can come to that site, but that's where our vaccine is housed. So that is another reason the numbers for Shelby County are typically more. Any questions before we do the Q&A?
I have a question for you. Could you please just give us a little background on yourself?
On myself? Yes. I am a community health nurse. I do diabetes education here at North Central. I've worked with North Central for 2 years. I also do some other programs, maternal child health programs like bullying and suicide prevention, Substance Use Disorder Strategy Coalition for North Central. I've been a nurse for 3 years and I was born and raised in Shelby County.
Thank you. Well, we'll hold the questions till later on. At this time, Ms. Rice, could you tell us a little bit about yourself and give
Absolutely.
us some remarks?
Yes, I've been in public health for about 20 years. I've been with North Central District Health Department. It'll be 4 years this May. I am a registered nurse. I also hold an MBA. And I was born and raised in a rural town community similar to the counties that I serve in Cynthiana, Kentucky.
Okay, and if you'd like to give us some informative remarks before we begin our questions.
Well, it's important that we get the community vaccinated for COVID-19. We need to reach herd immunity as a nation. And that starts, of course, with our state. That would allow us to be able to get back to what we consider normal, where we would not have to wear the mask and we wouldn't have to do the social distancing. So we are asking for help and so that folks can encourage others to come out and get vaccine here at North Central District or some other place where vaccine is being offered. The availability of vaccine is greater now. There's more of it, and there are more places that are offering the vaccine. So accessibility hopefully is no longer going to be a barrier.
Well, thank you both for those remarks, but now let's begin with our listener questions. Let's dig into answer some of those burning questions that our listeners have about the COVID vaccine. Let's see. I have a question in the chat box. If I'm a caregiver with a homebound client, how do I get someone to come to my home to give my mom a shot? And any one of you can answer that for me, please.
Yes, I'll take that. You can certainly call our COVID helpline, that number that was in the chat box, 502-390-2600, and let them know that you have a need for a homebound vaccination. We will certainly take your name and phone number and get that to the right person so that the next time we have an outreach event, we will reach out to you and get that scheduled.
Okay, this question is for you, Ms. Bergen. Does the chart include vaccines given by other providers such as Walmart, Walgreens, or just the ones given by the NCDHD?
And the charts were just for North Central District Health Department's data.
Okay, I have some more questions here. I have one. A listener stated, I'm 52 in good health, but with a history of heart surgeries. I have been trying to register on both the health department and Kroger website, but both say I'm eligible. But when I click to make an appointment, I am told none are available. I just want the J&J single shot. So I thought the increase in vaccines would make it simpler to register. How do I make this happen?
Well, I've got good news for this participant. They can get registered through North Central District Health Department and schedule an appointment. We just posted our schedule up on Friday. We still have approximately 150 appointments available. Miranda showed you early on in the presentation how to navigate through our website to schedule that electronic appointment. And if that is a challenge, then you can call the hotline and we can assist you in getting scheduled for that appointment. We are offering the Johnson & Johnson vaccine at this upcoming clinic that we're scheduling for. That clinic will be on Wednesday. And North Central is open to phase 3. So again, as Miranda said earlier, anyone can get vaccinated at our clinics. You just have to be 18 years of age or older. Because that's the type of vaccine that we have. That's the parameters in the vaccine that we have. So I would encourage that listener or viewer to please go to our website after this session is over and get scheduled or call our hotline, and we'll be happy to assist with getting that appointment.
Thank you for that. I have another question. What is the difference between the first and the second coronavirus shot other than dosage?
And so the dosage is actually the same. They're both 0.5 mLs, and they're exactly the same. The first one causes an initial immune response in the body. The second one is a boost immune response. And then both of those together will help the body to fight any novel coronavirus infections.
Okay, I have another question. How close are we to rolling out a vaccine for children? Are the vaccines good for life, or do they need to be repeated annually?
So we are seeing science in real time right now. I know a lot of us have not had experienced this before, and we are seeing real-time science. So we do not have all the answers, like how long this will last. We're still trying to figure that out and following the CDC recommendations. So as we have more people vaccinated, we'll be able to determine that. Did that answer that question?
I believe there was a question about when children would be able to get vaccinated. And currently Pfizer has some clinical trials that they're looking at vaccines in children younger than the age of 16. And so we are all watching that data closely, and hopefully They find out that it is an effective vaccine in children younger than 16 years of age. And I think they are shooting for a target of before the next school year being able to possibly roll that out, pending FDA approval for that.
Okay, thank you. I have another question here, and it's saying, I am hearing that people younger than 50 years old are having flu-like symptoms with the second dose of the vaccine compared to 50 plus who seem to have no reaction. Why is this?
So everyone's bodies are different, and there's no way to know if you're going to have a reaction to the vaccine or any vaccine initially. Possible reactions are a sore arm and flu-like symptoms, so fatigue, fever, headache, body aches, chills, those kind of symptoms are possible for anyone, any age. There's no way to know who's going to have those symptoms. We do recommend to be well hydrated before getting your vaccine, and that does seem to buffer some of those symptoms from happening.
And those symptoms are not necessarily a bad thing. It just is showing that your body is working hard to produce immunity against the virus, which is a good thing.
Okay, thank you. As you know, school has started up. So I have a question. Shelby County Public Schools just allowed all the students to return. The vaccine is not available to people 15 years or younger. With the variant being seen across the country, do you think we will see a spike? And this is a two-part question. Have you seen an increase in school-aged children being positive for COVID since they've returned to school?
Well, generally speaking, overall, COVID transmission has been relatively low in the school setting. Schools within our district, Shelby, Henry, Trimble, and Spencer, have been fairly compliant, very good compliance. There's been there with the mask enforcement throughout the school day and with the social distancing, which we think has contributed to the low numbers of cases within the school system there. So we would anticipate going forward to hopefully see similar positive results.
I have another question. Listeners, please keep the questions coming in. You can put them in the chat box and we'll ask them for you. The question I have now is, am I still protected from the virus if I only got one shot of the 2-dose vaccine?
In order to get maximum protection from your vaccine, from a 2-dose vaccine, you would need to get both of those. Studies have shown that after the first dose, 2 weeks after the first dose, you can have up to about 50% protection. But in order to get the maximum amount of protection and effectiveness from the vaccine, you would need to get both doses of a 2-dose vaccine.
Okay. What's the guidance for fully vaccinated individual, and what does fully vaccinated mean? And can we still be a carrier of the virus?
These are great questions. Fully vaccinated means 2 weeks after your second dose of your vaccine, if you've got the Moderna, or 2 weeks after the Johnson & Johnson, then you're considered fully vaccinated. And that means the vaccines had plenty of time to take effect in your body. So what this means, the CDC has just released, is that you can resume domestic travel after you're fully vaccinated without quarantining and COVID testing and those kind of rules that have been in place over the last year. There's still, some companies have certain policies, and certain states still have policies as well. So we do still have to follow the mandates for the state of Kentucky, which we still have a mask mandate here at this time because we do not have the vaccinations where they need to be. So we still need to wear a mask and those kind of things, but they say once you are fully vaccinated, the CDC says you can get with other fully vaccinated people without wearing a mask. But if you are going to be around those that have not been vaccinated, to still wear your mask and practice the social distancing.
And if you're in the home socializing with other families without social distancing and masking, you want to make sure that no one is at high risk for COVID. If that's the case, then mask is still recommended.
Thank you for that. I have a question. Many of us have heard about the variant of the virus in the United States now. What do we know about how well the vaccines work against these mutations or variants?
All of the data that we have up to this point is indicating that the vaccine is still protecting against those variants, preventing hospitalizations and serious illness from those strains if you're vaccinated.
Okay, another question. What will getting vaccinated actually mean for us? Social distancing, wearing masks, and not being able to gather with our friends and family are burdens that have been carried by many people since the start of the pandemic in early 2020. When do you think we will return to normal levels of connections with our friends and family?
Well, one of the biggest keys to getting back to normal is for us to reach herd immunity. Once we do that as a society, then I think we could look to no longer having to wear the mask and do the social distancing and return to life as we once knew it. The CDC vaccine data tracker shows that for our 4 counties, I'm going to share some data with you. Our charts that Miranda presented were related to the vaccinations we at North Central had given, but this information will encompass vaccines given not only by North Central, but by other providers. So for Henry County, total fully vaccinated individuals is 3,382, and that's about 21%. Shelby County, fully vaccinated, 8,031, which is about 16.4%. Spencer County, 1,817 fully vaccinated at 9.4%. And Trimble County has about 1,254 vaccinated at 14.8%. So those percents, you can see we still have a way to go before we can reach that level of herd immunity that we're looking for, which is why it's so very important that we continue to encourage others to get vaccinated, and we ourselves, if we have not received the vaccine, get vaccinated.
Thank you for that. And again, listeners, please put your question in our chat box that you would like to ask Ms. Rice or Ms. Virgin. They have a lot of informative information as I'm gathering it all, and I'm trying to obtain it all and ask, you all's very important questions here. So please put your questions in the chat box for Ms. Virgin or Ms. Rice. Let's see. Do you happen to know the number percentage of all the providers in each of the counties for the people who have been vaccinated?
Yes, I think that was just the information that I shared, if I'm understanding the question correctly. The percents that I just shared were encompassed North Central and other vaccine providers, and that data was county specific for the 4 counties we serve.
So do you think we're doing, really well in the community? How's your feelings on that?
I think we're off to a good start, but I think there's a lot of work left to be done. Our highest county is at about 16.4%, with our lowest at about 9.4%, fully vaccinated, and trying to reach again that herd immunity at least 70%.
Okay. What are some of the other locations where we can get the vaccine?
And so another great resource to use is your local pharmacy. They may be only doing a certain phase from the Kentucky Department of Public Health, and they may have a certain vaccine. So calling your pharmacy or going on their website and getting that information is a really great resource. Another resource is vaccinefinder.gov, and I can put that in the chat box. And you type in your zip code, and they tell you what locations are doing COVID vaccines around you.
Okay. Are there places where we can just drive through without an appointment?
And so every entity is different. I know the Kroger regional sites are typically drive-through. So that might be one. And I do want to say at our vaccine clinics, we will do vaccinations in the car if you're not able to get around easily. So if you do need that when you pull in our parking lot, you just let them know. And they always ask do you need it brought to your vehicle? So you just let us know, and we will certainly do what we can to accommodate you.
The listeners, again, I know you have some burning questions out there. And while I wait for you to put some more questions in here for me, I would like you to know, again, you can find further information on vaccine distributions through the website links that were posted in the chat box. The NCDHD COVID-19 hotline number is 502-390-2600. So if you have a burning question, you can call that hotline and ask them any question that's on your mind. Oh, I see some questions are coming through the chat box. Are any of the COVID variants in the district yet or in the state that you know of?
Yes, the variants are within the state of Kentucky, and we do have some confirmed cases of them within our district as well.
Okay. See what? Okay. What should you expect when you show up for an appointment? Do you need to bring an insurance card? Because I've heard of that.
Yes, so you do need to bring any insurance information, and if you have a social security number to fill out our consent form and bring that in with you. We have copies of the consent form at every clinic. And we also have that on our website that you could print out and fill that out at home, so you don't have to bring all those other documents with you, and just bring that consent form when you come to your appointment.
I would add that insurance is not required to get the vaccine. If you do not have insurance, that's okay. Come anyway, and we'll get you to fill out the necessary paperwork and provide you with the vaccine for free.
Okay, another question. Are the variant infections hitting a certain population harder, younger, older? Is there any data that it's hitting one population harder than the other?
I'm not aware of specific data of populations that it's hitting harder than the other. I can tell you that it is spreading throughout the nation, and it is anticipated that the British one will be the dominant strain before too much time passes.
Okay, last question, I promise, is North Central District Health Department still doing drive-up COVID testing?
Yes, we are doing COVID testing by appointments. So you would call the local health department in your county and schedule an appointment for any COVID testing needs that you have.
Okay, I did say that was the last one, but I got one more. If a person who have had COVID receive if a person who has had COVID receives the vaccine, is the reaction to the vaccine more severe?
No, I think that that's a myth. Again, it's very similar to what Miranda had alluded to earlier. Everyone reacts a little differently to the vaccine, but whether or not you've had COVID isn't a factor, a real factor in determining what type of symptom you may have from the vaccine.
Okay. I have questions still coming in, even though I said it was my last. Is it safe for a fully vaccinated person to meet with mass with another who decided never to get the vaccine?
So the CDC recommends that if you are getting together with someone that has not been vaccinated, to still wear masks to prevent and slow that spread of COVID-19, to protect them and yourself from getting COVID.
Okay, I have, and this is the last question. As you know, we're getting ready to hit what we call summer break. Do you think that that will cause a rise in positive cases for us at this time?
I think there are a lot of factors at play when it relates to that. If individuals continue to wear masks, social distance, and apply the rules that CDC has put before us, and if folks get vaccinated before doing that type of travel, I think we can see the numbers remain fairly low. But if that's not the case, then I think there's risk that we could see another escalation in the numbers.
Thank you. We are now nearing the end of this conversation, but before we close, I would like to ask Ms. Rice and Ms. Virgin to share any key messages you would like each of us to take away from this conversation today.
Well, from my perspective, I would say get vaccinated, get vaccinated, get vaccinated. Encourage others to get vaccinated. Know that North Central District Health Department is open to all the phases. And if you're 18 years or older, we welcome you. We want you to come and get vaccinated. Just go to our website to look for when that electronic scheduler is opening, typically on Fridays, and get scheduled for clinics that typically run on Wednesday. And we're here to serve you, and we're happy to take any questions that you have or assist you in any way. And you could reach out to us via the hotline that we mentioned earlier.
Perfect. Ms. Rice, that's my thing too. Please get vaccinated. Help us help you. We want to vaccinate you. So please call us on our helpline. Again, that number's in the chat. Go to our website, schedule an appointment. If you have any other questions, I'd be happy to assist. I put my contact information in the box. So please get vaccinated. Encourage your family and friends to get vaccinated. We want you to.
Thank you, Ms. Rice and Ms. Virgin. It has been a pleasure to learn from you today. The two of you had some very, very important information. And also, I just want to let people know that AARP Kentucky has a web page too on vaccine, and it's https://aarp.org/KY vaccine. And it should be posted in the chat for you. But one final piece of information that I would like for all our listeners to get: please be aware of COVID scams. Scammers may try to offer quick access to vaccines for a fee. They claim to sell in-demand supplies like face masks and test kits, and they even hack into social media accounts and send text messages saying You've been exposed and need to click on this link for more information. At this time, engage your inner skeptic. When you see ads like this and special offers making these claims, please be aware. Real contact tracers will not send you a link to click or ask for money or sensitive personal information. Anytime this happens or you have a question, please call the AARP Fraud Watch Network helpline at 877-908-3360. That's 877-908-3360. And we'll put that in the chat. And at this time, on behalf of AARP Kentucky, I want to say thank you to everyone for taking part in today's Zoom discussion on COVID-19 vaccine. And again, a special thanks to our guests, Ms. Ronya Rice and Ms. Miranda Bergen. We hope everyone found this session informative and engaging. And we thank you for participating and asking such great questions. And I wish you all would have a wonderful, wonderful day. And thanks again, Ms. Bergen and Ms. Rice.